In 2016, it was estimated that about 200,000 deaths occurred in Ghana, and only a quarter of these deaths were registered, and most of these deaths occurred in the communities. With this, we decided to pilot and understand the extent of this issue in the country. So Greater Accra region was used for the pilot. A third of police stations in the Greater Accra region were sampled for the data collection. Between January to December 2020, and 510 cases were recorded. The distribution shows the normal pattern of death. These deaths required post-mortem, but we realized that these were not done. Also, the results shows that more than half of the dead were not registered, burial permit not issued, but the bodies were released for burial. This creates missed opportunity for registering such deaths and generating the needed vital statistics for health policy and planning.
This has become necessary that we go on with this upgrade of our administrative data, because the country, remember in 2014, did an assessment of the civil registration and vital statistics system in the country, and the results that came up regarding mortality statistics was not the best at all.
We have identified that if this country can make a lot of strides in building our data systems, you compile a lot of data, which often nobody pays attention to it. Even you yourself don't know the value of that data, because you're compiling it as part of your policing processes, your policing work. But there is value in that data.
As part of the efforts to improve the National Civil Registration and Vital Statistics system for the overall improvement of the quality mortality statistics, or MDAs, which the Ghana Police Service is part of it or is included, have been tasked to harmonize or strengthen their administrative data system to respond to the country's data needs.
The law says that the death needs to be registered in the district that it occurs. So, for example, if somebody dies in Kolebu and the death has been registered in Kolebu, but they are going to bury the person in, say, Koforidua, you cannot get a burial permit from Kolebu. You get a burial permit where you are going to bury. So you need to go with the death certificate from Kolebu to Koforidua to now get a burial permit.
If you have very good system of tracking births and deaths and migration, we will reduce how much investment we put in doing censuses. Because at any point in time, we know the number of people. Just like the example I gave you about this room. We know the number of people in. So it will reduce the costs of conducting the census.
Sometimes when we are doing the post-mortem, you go to the health facility and the bereaved family, when the body is known, they are in trouble and still they are supposed to pay for the post-mortem. Sometimes if they don't have the money, they will leave the body.
What we are doing is part of the national rollout. So we are starting with Eastern region. And how we are planning to do this, we are doing the training region by region basis. And these are per the characteristics or the nature of such deaths. These are deaths that should be reported to the police stations once they occur. So the point of data collection in this case is the police station. We realized over the years, at least for the last 5 to 6 years where we've been implementing this project, that data on mortality comes from different sources. and the various institutions collect their data per the legal mandate. But this data is not speaking to any other system. So the different institutions have their data, but it's not being shared across institutions. And so we come up with a situation where we have very low coverage of death registration, and the causes of death data is even much lower. So we are doing less than 10% when it comes to cause of death registration compared to the international standards of 90% and above. And also in terms of our death registration coverage, we are only at about a quarter of the deaths that occur in the country. So as part of the aims of this project, we wanted to be able to bring together all these different institutions and harmonize their data into an integrated system such that we will be able to, at any point in time, get a full picture of mortality data for Ghana, and this will also feed into the National Civil Registration and Vital Statistics System.
Per the population dynamics, we know that the components of population is made up of the death, the births, and then migration. And the training that we currently undertaking here relates to death. And we know that the police are one group that also deal with death cases in this country.
It also serves as a backup should something happen to the tablets, either through theft or damage, that you are not able to retrieve the data from the tablets. HQ can be able to give you back all the cases you have done so far before it will give you till the time you think.
With the data gathering app, which we were taught at the training, I think it is safer than the handwritten documents which were being used formally, because with this data gathering app, immediately you are done with your entries, you can just key into headquarters for it to be saved.
The value of this is going to help the Ghana Police Service to strategize when we see the number of deaths that are occurring in the country. It's also going to help the police service to take policies in respect of the agencies that are involved in the data collection in respect of CID, the MTTD.
There are certain things I didn't know, especially when it comes to the registration of death. We don't follow those aspects. When the accident happens and there's a dead person or dead body, we go to the scene, we do the post-mortem, but we don't follow the registration of the dead body. So this program has, helped me that moving forward, I will see to it that all the dead bodies are registered before even released to the bereaved families.
Before this period, we felt like when a case is reported and investigated, the moment you get the postmortem report, you give it to the family for them to go and bury their dead. But now I've gotten to understand that because we need to get proper data system about the death, we as investigators must help bereaved families to get the permit to bury the dead. And in doing so, we also help in registering the death and giving proper data on the death in this country.
This training seeks to improve our capacity in terms of how we can accurately collect mortality data, especially that has to do with road traffic accidents, violent deaths, and other related issues. And we know this kind of data for some time now has clearly been lacking of, even if it exists as store, not very accurate. And so in partnership with the Ghana Police Service, they are currently training us, and this would enhance our capacity to be able to collect and report accurately on mortality data, especially the road traffic accident, violent deaths, and other related deaths.